Today, we're going to help you realign that kinetic chain of yours by taking on Knee Varus. It's often referred to as being bow-legged or pigeon-toed. What happens is your bigger shin bone, the tibia, which is supposed to be aligned with your femur, your thigh bone, it turns inward, which actually makes your knees turn outward, giving you that bow-legged stance. And the symptoms you get from this are very similar to knee valgus, knock knee. You get it from injury or infection. You can get it from being obese, having arthritis. If you have rickets, rickets again is if you're lacking vitamin D, calcium, and phosphate. Your bones get weak, and that causes your knees to do things to put them out of alignment. The symptoms are very similar to knee valgus. You get the joint stiffness, the joint pain, and when you're in that out of line position, the bow-legged position, guess what? It infects the kinetic chain because we're all connected. It trickles down to the ankles, the feet, moves up to the hips, and puts you out of balance. We're going to fix that. We'll start with external hip rotation. See, your hips need to be flexible to minimize lower back pain that's associated with poor knee alignment. See how we're all connected there? Start by standing, feet again shoulder width apart. What you're going to do is you're going to move your left leg out to your side approximately 6 inches. Lift your left foot off the ground about 1 to 2 inches. Turn your head to the right, keeping your left foot elevated. Slowly rotate your left foot to the left as far as is comfortable. Hold that position for about 20 to 30 seconds and repeat this with the right side. External hip rotation is when your legs are turning outward away from the medial portion of your body, and your knees are turning outward as well. Internal hip rotation is the turning of the femur bone, that's the thigh bone, towards your pelvis inward, while your feet are going outward. Internal hip rotators are great in sport. When you're running, you want to change direction, make a cut. They help you to decelerate and then to re-accelerate with power. So you gotta work on these, especially if you're an athlete. The sitting stretch is gonna help you increase the range of motion of your hips while also strengthening your hips and your leg muscles. What you do is you take your left leg to start with and you place your ankle on your right knee, and then all you're gonna do is lean back 10 to 12 inches and you should feel that stretch on your left side. You can hold that for 20 to 30 seconds, do about 3 sets, and then switch legs. Lunges are also great for knee varus, and they're great for a whole host of other things. But think about it. For your knee, when you strengthen your muscles around it, you're taking the pressure off the actual knee joint. That's going to help. Be ever so mindful when you do these lunges to keep strict form, keep everything aligned. You're going to start by standing, facing forward. Your feet are together. First, you're going to step forward with your left leg. Lower your right leg as far as you feel comfortable with. Then, straighten your right leg. Move your left leg next to your right leg and repeat this process with your right leg moving forward. If you have balance issues, you can put a chair or something to stabilize you nearby. And of course, squats, the king of all exercises. Great for a whole host of things, including knee varus. But you gotta have strict form. I talked about it in the last video. I'll put a link down below for the squat. Be sure to watch that because it's imperative you get that form down. It's going to help you in so many realms. Yoga is also great for knee varus. Think about the flexibility you're getting when you're doing yoga. You're increasing your range of motion and you're strengthening the muscles around your knee. When you do that, you're taking pressure off the knee. And with the muscles, you can keep it aligned how it should be aligned. There you have it. A whole host of exercises and stretches to correct knee varus and get you back on track. Next, We're moving up the kinetic chain. We'll talk about the hips and the back. And there's 5 major deviations that are very common. We'll start with the first one, sway back. See you then.